Rompe Pecho Max Multi-Symptoms is a combination medication that temporarily treats symptoms such as cough, chest congestion, fever, body aches, and stuffy nose caused by the common cold, flu, or other breathing illnesses. It contains guaifenesin, which helps to thin and loosen mucus in the lungs, making it easier to cough up. Dextromethorphan is a cough suppressant that reduces the urge to cough, and decongestants help to relieve stuffy nose symptoms. This product also contains acetaminophen, a non-aspirin pain reliever and fever reducer. It's important to note that this medication is not usually used for ongoing coughs from smoking, asthma, or other long-term breathing problems unless directed by your doctor. It's not recommended for children under 6 years old, and some forms are not recommended for children under 12 years old. It's important to carefully follow all dosage directions to decrease the risk of serious side effects, and to not use this product to make a child sleepy. It's also important to avoid giving other cough and cold medication that might contain the same or similar ingredients. If you have any questions or concerns, be sure to ask your doctor or pharmacist for more details about using this product safely. When using Rompe Pecho Max Multi-Symptoms, it's important to carefully follow the directions on the product package. Take this medication by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. It's essential to drink plenty of fluids when using this medication, as the fluid will help loosen the mucus in your lungs. If you are using the liquid form, be sure to measure your dose using a medication measuring device or spoon. Do not use a household spoon because you may not get the correct dose. For some liquid products, you may need to shake the bottle well before each dose, so be sure to check the directions on the product package. The dosage of Rompe Pecho Max Multi-Symptoms is based on your age, medical condition, and response to treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval, as improper use may result in serious harm. If your condition lasts for more than 5 to 7 days, if it gets worse, or if it occurs with a persistent headache, rash, or fever, it's important to consult a doctor as these may be symptoms of a serious medical problem. Some common side effects of Rompe Pecho Max Multi-Symptoms include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. It's important to contact your doctor or pharmacist if these effects persist or worsen. However, many people using this medication do not experience serious side effects. If prescribed by your doctor, it's because they have determined that the benefits outweigh the potential risks. Be sure to inform your doctor immediately if you experience any serious side effects such as mental/mood changes, shaking, weakness, problems urinating, or changes in heartbeat. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so contact your doctor or pharmacist if you experience any other effects not mentioned. As for the optimal timing and dosage, it's best to follow your doctor's instructions. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider for more information. Acetaminophen is one of the ingredients in Rompe Pecho Max Multi-Symptoms. It's important to be cautious with the amount of acetaminophen you take, as too much can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, and those with liver problems or children should take less. It's important to ask your doctor or pharmacist how much acetaminophen is safe for you to take. It's also important to not use any other medications containing acetaminophen without checking with your doctor or pharmacist first. Acetaminophen can be found in many over-the-counter and prescription medications, such as pain/fever drugs or cough and cold products. Make sure to check the labels on all your medications to see if they contain acetaminophen, and ask your pharmacist if you're unsure. If you happen to take too much acetaminophen and experience symptoms like nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, or dark urine, it's important to seek medical help right away, even if you feel well. Daily alcohol use, especially when combined with acetaminophen, can also harm your liver. It's best to avoid alcohol while taking Rompe Pecho Max Multi-Symptoms. Before taking Rompe Pecho Max Multi-Symptoms, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any breathing problems, diabetes, heart issues, high blood pressure, kidney or liver disease, and any other health concerns. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using heavy machinery until you know how this medication affects you. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit sugar, alcohol, or aspartame, be cautious when using the liquid form of this product. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you are taking, including Rompe Pecho Max multi-symptoms. For older adults, be aware that they may be more sensitive to the side effects of this medication. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of taking this medication with your doctor. It's important to be aware of any potential drug interactions with Rompe Pecho Max multi-symptoms. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. Be cautious of interacting products such as ketoconazole, levoketoconazole, and rolapitant. Always check the labels on all your medications carefully to make sure you are not taking more than one product with the same ingredients. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, be sure to inform your doctor or pharmacist. It's also important to note that this medication may interfere with certain urine lab tests, potentially causing false test results. Always make sure lab personnel and all your doctors are aware that you are using this drug. If you or someone else has taken too much Rompe Pecho Max multi-symptoms and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center for assistance. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, agitation, confusion, hallucinations, and seizures. If you experience any of these symptoms, seek medical help right away. It's important to follow your doctor's instructions when taking Rompe Pecho Max multi-symptoms. This medication should not be shared with others, as it is specifically prescribed for your condition. It's also important to attend all scheduled medical and lab appointments to monitor your progress and make any necessary adjustments to your treatment plan. If you are taking Rompe Pecho Max multi-symptoms on a regular schedule and you forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take 2 doses at the same time. As for the best time to take this medication, it is recommended to follow the instructions on the packaging or consult with your healthcare provider for the optimal timing. When storing Rompe Pecho Max multi-symptoms, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.